So when you moved, so as an organisation, so you were fairly decent size in Tasmania.
Yeah.
And as you intended, the first move from going to Tasmania to which state you went to, and what was the premise or what was the value alignment, and why did you feel, and what was the purpose going to a different state as the first move?
Our view was that so we turned over maybe 12 or 13 million when I joined, and in Tasmania that was a big service back then.
Mm-hmm.
So we had a level of influence that we were able to try and assist government with policy. We were able to work with some of the advocacy organisations, and the sector was very well connected. It used to work very well together in trying to improve the way that we do things. But clearly that changed for us when you had a national system with the NDIA. And we had a question around, well, what did that mean longer term for us, and what did it mean longer term for the sector? If you were going to more than double the sector, it was going to be a nationally administered scheme, then how are we going to continue to be able to deliver our mission? And so we determined early on that we needed to get to a scale where we would be robust and sustainable enough to withstand shocks like COVID and things like that have come along.
Mm-hmm.
But equally, we realised we couldn't just do that in Tasmania, because there needs to be a diversity of providers in each of the territories and states that we operate. And so it made sense to come somewhere else. And so we looked across, and Victoria in particular has really good social policy settings. There was a deep commitment to making sure that people with disability were well supported in the community. And so we worked with the Transport Accident Commission over here, or the Compensable Motor Accident Insurer, about providing supports for them, and then worked with the Victorian Government in how they were outsourcing the supported independent living services back in 2018.
That's good.
So one of 5 providers that worked with government to transfer those services into the community sector, so that it would fit within the new requirements of the NDIS.